This is a partnership between Hanover Welfare Services, Melbourne University, Flinders University and Melbourne City Mission. And we were examining the relationship between precarious housing and health. And by precarious housing, we mean unaffordable housing or insecure housing or unsuitable housing. At Hanover and Melbourne City Mission, what we see are a number of people with health issues, physical health and mental health issues, who are in very unstable housing. And we wanted to understand the relationship between their health and their precarious housing so that we could design the best possible service responses to those people and really advocate for policy that meets the needs of those people.
Our project with Vic Health allowed us to look for the first time at who is in precarious housing in Australia. And we found that women in particular were much more likely to be in unaffordable housing than men, that single parent households were more likely to be in precarious housing, and that people who were in casual employment or low income people were more likely to be in precarious housing. When we then went on to look at the relationship between housing and health, we found a stronger relationship between precarious housing and mental health than for physical health. And when we spoke to a group of young single mums, we found that for them the most important aspect of housing was stability. They wanted to be in stable housing that allowed them to make connections to their community. And that was really important for them and for their children.
There's a number of implications from the research, some about precarious housing itself, that we need to target our housing responses to particularly vulnerable populations. And not only that, we need to join up or link our housing policy and service delivery to our health service delivery, and especially our mental health service delivery, so that we can better meet the needs of people who find themselves in precarious housing and very unstable circumstances. I think there's some other implications that include some further research around the relationship not only between precarious housing and health inequities, but importantly the relationship between these and precarious employment, because we know that these things are interlinked and that they have a bearing on people's future. The other final thing is that place is really important to people in terms of their housing and their health. And if we place people out of place where they have no connections, then it has a serious impact on their mental health.